Phlebotomy exam review questions. Question 1. Which of the following options describes a pre-analytical error that can occur in phlebotomy? Option A. Miscalibrating an automated glucose analyzer machine. Option B. Misidentifying a patient or mislabeling a specimen collection tube at the bedside. Option C. Delaying the entry of finalized lab results into the electronic medical record. Option D. Misinterpreting a cellular structure under a microscope. The correct answer is option B. Misidentifying a patient or mislabeling a specimen collection tube at the bedside. Misidentifying a patient or mislabeling a tube occurs before the sample is analyzed, making it a pre-analytical error. These errors are especially dangerous because the laboratory may produce a technically valid result on the wrong specimen. Analyzer calibration and final reporting occur in later phases. Question 2. Which of the following statements is true regarding standard precautions in healthcare settings? Option A. They apply only to patients with known, documented infectious diseases. Option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C. They require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D. They permit the recapping of used needles as long as you use 2 hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 3. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A. N95 respirator and gloves. Option B. Gown and gloves. Option C. Surgical mask and face shield. Option D. Gown, mask, and goggles. The correct answer is option B. Gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 4. Which of the following actions can lead to a false elevation in a patient's serum potassium level? Option A. Releasing the tourniquet within 1 minute of needle insertion. Option B. Keeping the patient's arm down during the venipuncture procedure. Option C. Allowing the patient to pump their fist repeatedly before and during the draw. Option D. Transporting the specimen to the laboratory within 30 minutes. The correct answer is option C. Allowing the patient to pump their fist repeatedly before and during the draw. Repeated fist pumping can falsely elevate serum potassium by promoting local muscle activity and hemoconcentration. Potassium may shift out of cells or become concentrated in the specimen. A relaxed fist without pumping is preferred during routine venipuncture. Question 5. How many times should a light blue top tube be inverted immediately after collection? Option F. 1 to 2 times. Option B. 3 to 4 times. Option C. 5 to 8 times. Option D. 10 to 12 times. The correct answer is option B. 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 6. What should a phlebotomist do if they note that a light blue top tube did not fill completely due to a loss of vacuum during the draw? Option A. Use the partial sample anyway and send it to the lab. Option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. Option C. Pour blood from a green top tube into the light blue tube to top it off. Option D. Shake the tube vigorously to force the remaining air out. The correct answer is option B. Discard the partial tube and draw a fresh light blue tube to ensure the correct 9:1 blood to additive ratio. An underfilled light blue tube must be discarded and recollected because the 9:1 blood to citrate ratio is no longer valid. Sending the partial tube may produce falsely prolonged coagulation results. Transferring blood between tubes or shaking the tube cannot restore the required ratio. Question 7. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 8. Which of the following standard precautions applies to the disposal of used venipuncture needles? Option A. Recapping the needle before throwing it away. Option B. Placing the needle in a biohazard bag. Option C. Activating the safety device and placing it in a sharps container. Option D. Dropping the needle into a regular waste bin if no blood is visible. The correct answer is option C. Activating the safety device and placing it in a sharps container. Used needles must be made safe immediately and placed into an approved sharps container at the point of use. Recapping, carrying loose needles, or placing them in bags creates preventable needle stick risk. Visible blood is not required for an item to be treated as contaminated after use. Question 9. A serum separator tube, SST, contains an additive that assists in what process? Option A. Preventing coagulation. Option B. Accelerating coagulation. Option C. Inhibiting glycolysis. Option D. Preserving blood cultures. The correct answer is option B. Accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 10. What should a phlebotomist use to cleanse the skin surface prior to collecting a blood alcohol specimen for legal purposes? Option A. 70% isopropyl alcohol prep pads. Option B. Povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Option C. Tincture of iodine solution. Option D. Concentrated hydrogen peroxide spray. The correct answer is option B. Povidone iodine or chlorhexidine gluconate or non-alcoholic soap and water. Blood alcohol specimens for legal testing should be collected using a non-alcohol skin cleanser such as povidone iodine, chlorhexidine, or soap and water. This avoids any appearance that alcohol from the prep contaminated the specimen. Routine isopropyl alcohol pads are avoided for forensic alcohol collections. Question 11. What should a phlebotomist do if an outpatient becomes pale, sweaty, and complains of feeling dizzy before you insert the needle? Option A. Proceed quickly with the puncture before they pass out completely. Option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Option C. Instruct the patient to take deep, rapid breaths to hyperventilate. Option D. Give the patient a glass of hot water to drink immediately. The correct answer is option B. Terminate the preparation, lower the patient's head or recline the chair, and provide a cool cloth or assistance. Pallor, sweating, and dizziness before needle insertion suggest an impending fainting episode. Preparation should stop, the patient should be reclined or assisted safely, and symptoms should be managed before any draw attempt. Continuing may lead to syncope, falls, or injury. Question 12. What should a phlebotomist do if they note that an inpatient's identification band is attached to the bed rail instead of the patient's body? Option A. Scan the band on the bed rail and proceed with the draw. Option B. Refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. Option C. Ask the patient's visitor to confirm that the band belongs to the patient. Option D. Cross out the name on the band and write it on a new tube label. The correct answer is option B. refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. An ID band attached to the bed rail does not reliably identify the patient. The phlebotomist should not collect until nursing staff verifies identity and attaches a proper band to the patient. Scanning or using a detached band creates a wrong patient risk. Question 13. What type of collection is performed to screen for hidden blood in a stool specimen? Option A, occult blood test, GWAEC. Option B, culture and sensitivity, C&S. Option C, DOVA and parasites, O&P. Option D, fecal fat quantification. The correct answer is option A, occult blood test, GWAEC. An occult blood test, often using a GWAEC method, screens stool for hidden blood. It can help detect gastrointestinal bleeding that is not visible. Culture, ova and parasite testing, and fecal fat analysis evaluate different stool conditions. Question 14. Which of the following items is the preferred antiseptic for cleaning a site prior to performing an arterial blood gas, ABG, draw? Option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Option B, plain sterile water. Option C, diluted hydrogen peroxide solution. Option D, sodium hypochlorite spray. The correct answer is option A, 70% isopropyl alcohol followed by chlorhexidine gluconate or povidone iodine. Arterial puncture sites require strong antisepsis because the procedure is deeper and carries higher complication risk than routine venipuncture. Alcohol followed by chlorhexidine or povidone iodine is commonly used according to policy. Sterile water, peroxide, or bleach sprays are not appropriate skin antiseptics for ABG collection. Question 15. What should a phlebotomist do if an inpatient's door is closed and a sign states no visitors, see nurse before entering? Option A, knock loudly, open the door, and walk right in to maintain efficiency. Option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C, skip the patient and come back at the end of the shift without checking in. Option D, call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 16. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A, prone position. Option B, high Fowler's position. Option C, supine with legs elevated or flat. Option D, standing upright with assistance. The correct answer is option C, supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 17. What type of vessel contains thick, muscular walls and carries blood away from the heart under high pressure? Option A, vein. Option B, artery. Option C, capillary. Option D, venule. The correct answer is option B, artery. Arteries have thick, muscular, elastic walls that carry blood away from the heart under pressure. This structure allows them to tolerate pulsatile pressure generated by ventricular contraction. Veins return blood at lower pressure and often contain valves. Question 18. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 19. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A, facing downward. Option B, facing upward. Option C, facing to the left. Option D, facing to the right. The correct answer is option B, facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 20. Which of the following tests evaluates the extrinsic coagulation pathway and is commonly monitored in patients taking oral warfarin therapy? Option A, activated partial thromboplastin time, APTT. Option B, prothrombin time / international normalized ratio, patient / INR. Option C, bleeding time determination. Option D, complete blood count, CBC. The correct answer is option B, prothrombin time / international normalized ratio, patient / INR. Patient and INR evaluate the extrinsic pathway and are commonly used to monitor oral warfarin therapy. Warfarin affects vitamin K-dependent clotting factors that influence this test. APTT is used more often for heparin therapy and the intrinsic pathway. Question 21. Which of the following additives is found in a yellow top tube used for human leukocyte antigen, HLA, typing or DNA studies? Option A, sodium polyant whole sulfonate, SPS. Option B, acid citrate dextrose, ACD. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option B, acid citrate dextrose, ACD. Yellow ACD tubes contain acid citrate dextrose and are used for HLA typing, DNA studies, and some cellular testing. ACD preserves cells by anticoagulating the specimen while supporting cell viability. SPS yellow tubes are intended for blood cultures and have a different additive. Question 22. What color top tube contains sodium heparin or lithium heparin and is the primary choice for stat chemistry determinations? Option A, green top. Option B, light blue top. Option C, lavender top. Option D, yellow top. The correct answer is option A, green top. Green top tubes contain sodium or lithium heparin and are commonly used for stat chemistry testing. Heparin allows plasma to be separated quickly without waiting for clot formation. Serum tubes require clotting time and are not always ideal for urgent chemistry turnaround. Question 23. Which of the following actions represents the correct method for mixing an additive collection tube after drawing? Option A, shaking the tube vigorously up and down 10 times. Option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Option C, letting the tube sit completely undisturbed in a vertical rack to mix over time. Option D, rolling the tube vigorously between your palms for 2 minutes. The correct answer is option B, inverting the tube gently back and forth the recommended number of times, typically 3 to 10 depending on tube type, to ensure adequate mixing without causing hemolysis. Additive tubes must be mixed by gentle inversion for the number of times recommended for that tube type. This distributes the additive evenly without causing hemolysis. Vigorous shaking or inadequate mixing can create clots, cell damage, or inaccurate results. Question 24. Which of the following factors can cause hemoconcentration during a blood collection procedure? Option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Option B, releasing the tourniquet as soon as the first tube begins to fill with blood. Option C, utilizing a needle with a large lumen, such as a 21-gauge needle. Option D, having the patient remain in a supine position for 20 minutes before the draw. The correct answer is option A, leaving the tourniquet tied on the arm for 3 minutes while searching for a vein. Leaving a tourniquet on for several minutes causes venous stasis and fluid shifts out of the vessel. This concentrates cells and analytes, producing hemoconcentration. The tourniquet should be released within the recommended time and reapplied only after an appropriate pause if needed. Question 25. What is the correct angle of insertion for a standard multisample needle during a venipuncture? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B, 15 to 30 degrees. A standard straight needle is usually inserted at a shallow 15 to 30 degree angle to enter the vein smoothly. This angle helps avoid passing through the vein or striking deeper structures. Very shallow angles can miss the lumen, while steep angles increase tissue trauma. Question 26. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A, full name and room number. Option B, full name and date of birth. Option C, the tending physician and bed number. Option D, date of birth and diagnosis. The correct answer is option B, full name and date of birth. Two reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 27. If a phlebotomist notices a hematoma beginning to form during a blood draw, what action should be taken immediately? Option A, adjust the depth of the needle to stop the swelling. Option B, remove the tourniquet, withdraw the needle, and apply firm pressure. Option C, advance the needle further to bypass the hematoma. Option D, request the patient to pump their fist to redistribute the blood. The correct answer is option B, remove the tourniquet, withdraw the needle, and apply firm pressure. A developing hematoma means blood is leaking into surrounding tissue, so collection should stop at once. Releasing the tourniquet, withdrawing the needle, and applying firm pressure limits bleeding and tissue damage. Advancing the needle or continuing the draw can enlarge the hematoma and increase patient injury. Question 28. Which of the following is the most critical step in performing any phlebotomy procedure? Option A, choosing the correct size needle. Option B, verifying patient identification. Option C, selecting the appropriate vein. Option D, applying the tourniquet tightly. The correct answer is option B, verifying patient identification. Patient identification must be verified before collection because every result is linked to treatment decisions for one specific person. A name alone is not enough when facility policy requires two identifiers such as full name, date of birth, or medical record number. Needle size, vein choice, and tourniquet technique matter only after the patient's identity has been confirmed. Question 29. If a phlebotomist must collect blood from a patient with an active, running foreline in both arms, what is the preferred option? Option A, draw the blood from a capillary puncture if the tests allow. Option B, turn off the for yourself and draw above the line immediately. Option C, draw from the foot or ankle without a physician's order. Option D, postpone the draw indefinitely until the patient is discharged. The correct answer is option A, draw the blood from a capillary puncture if the tests allow. When both arms have running forelines, venous sampling near either infusion may be diluted or contaminated. If the ordered tests permit capillary collection, skin puncture can avoid the active infusion sites. Turning off force or using lower extremity veins requires nursing or provider direction and facility policy. Question 30. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A, adjust the needle angle to try to drain the hematoma into the collection tube. Option B, terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C, instruct the patient to pump their fist forcefully to redistribute the blood. Option D, advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B, terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 31. Which of the following tubes contains no additives or gel barriers and is often used as a discard tube or for specialized serum testing? Option A, clear or plain red glass top. Option B, light blue top. Option C, lavender top. Option D, light green top. The correct answer is option A, clear or plain red glass top. Clear or plain red glass tubes contain no additive or gel and may be used as discard tubes or for selected serum testing. They are useful when additive carryover must be avoided. Colored additive tubes contain substances that can interfere with tests not designed for them. Question 32. What clinical complication can arise if a phlebotomist punctures the skin through wet alcohol? Option A, the needle will slip and miss the vein entirely. Option B, the red blood cells in the sample may hemolyze, ruining the specimen integrity. Option C, the patient's blood pressure will drop rapidly. Option D, the vacuum inside the collection tube will increase significantly. The correct answer is option B. The red blood cells in the sample may hemolyze, ruining the specimen integrity. Puncturing through wet alcohol can introduce alcohol into the specimen and irritate the site. It may contribute to hemolysis and can cause a stinging sensation for the patient. The antiseptic must air dry completely before needle insertion. Question 33. What is the primary purpose of applying a tourniquet during a venipuncture procedure? Option A, to stop the arterial blood flow to the limb. Option B, to engorge the veins and make them more palpable. Option C, to anchor the vein and prevent it from rolling. Option D, to ensure the sterility of the puncture site. The correct answer is option B, to engorge the veins and make them more palpable. A tourniquet temporarily slows venous returns so veins become fuller, easier to see, and easier to palpate. It should not stop arterial flow or be tightened enough to injure the patient. Vein anchoring and skin antisepsis are separate steps with different purposes. Question 34. What type of specimen is generated when a blood sample collected in a plain red top tube is allowed to clot and then centrifuged? Option A, plasma. Option B, serum. Option C, whole blood. Option D, fibrinogen-rich extract. The correct answer is option B, serum. Serum is produced when blood is allowed to clot and the clotted specimen is centrifuged. It is the liquid portion remaining after fibrinogen and clotting factors are consumed in clot formation. Plasma requires an anticoagulant and still contains clotting factors. Question 35. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 36. Which of the following factors is a major cause of specimen rejection in the laboratory? Option A, collecting a lavender top tube for a CBC test. Option B, submitting an underfilled light blue coagulation tube. Option C, delivering a chemistry specimen to the lab within 4 to 5 minutes. Option D, affixing a handwritten label over a pre-printed barcode label. The correct answer is option B, submitting an underfilled light blue coagulation tube. Underfilled light blue coagulation tubes are a common cause of specimen rejection because the blood-to-citrate ratio is invalid. Excess citrate can alter clotting times and make results unreliable. Proper tube fill is more critical for citrate tubes than for many serum or EDTA tubes. Question 37. A patient refuses to have their blood drawn. What is the most appropriate next step for the phlebotomist? Option A, convince the patient by explaining the doctor's orders. Option B, proceed with the draw while the nurse holds the patient's arm. Option C, document the refusal and immediately notify the nursing staff or provider. Option D, leave the room and mark the collection as completed. The correct answer is option C. Document the refusal and immediately notify the nursing staff or provider. A competent patient has the right to refuse venipuncture, even when a provider ordered the test. The phlebotomist should document the refusal and notify nursing staff or the ordering provider so follow-up decisions can be made. Attempting to persuade aggressively or drawing against the patient's wishes can create legal and ethical problems. Question 38. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 39. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A, informed consent. Option B, expressed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 40. What occurs during the pre-analytical phase of laboratory operations? Option A, running standard controls on a chemistry profile machine. Option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. Option C, interpreting a bone marrow biopsy under a microscope. Option D, transmitting final electronic medical record entries to billing. The correct answer is option B, all processes involved in patient identification, collection, handling, and transport prior to actual sample analysis. The pre-analytical phase includes everything that happens before actual testing, including orders, patient identification, collection, handling, and transport. Many laboratory errors occur in this phase because specimen quality is established before analysis begins. Analyzer operation and result reporting belong to later phases. Question 41. Which of the following veins is located on the outer thumb side of the arm and is the third choice for venipuncture? Option A, cephalic vein. Option B, basilic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option A, cephalic vein. The cephalic vein lies on the lateral, thumb side of the arm and is often a later choice for venipuncture. It may be more difficult to anchor and access than the median cubital vein. The basilic vein is medial and carries greater nerve and artery risk. Question 42. What color top tube contains the additive EDTA and is the primary tube used for a complete blood count, CBC? Option A, lavender top. Option B, light blue top. Option C, green top. Option D, gray top. The correct answer is option A, lavender top. Lavender tubes contain EDTA and are the primary tubes for CBC testing. EDTA prevents clotting while preserving blood cells for accurate counts. Serum or heparin tubes do not provide the standard specimen required for routine CBC analysis. Question 43. What is the correct order of draw for a multitube venipuncture sequence involving a coagulation tube, a blood culture, and a hematology tube? Option A, light blue, blood culture, lavender. Option B, blood culture, light blue, lavender. Option C, lavender, light blue, blood culture. Option D, blood culture, lavender, light blue. The correct answer is option B, blood culture, light blue, lavender. Blood cultures are collected first to maintain sterility, followed by light blue coagulation tubes and then lavender hematology tubes. This order reduces contamination and additive carryover. Drawing EDTA before citrate can interfere with coagulation results. Question 44. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, option B 5:1, option C 9:1, option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 45. What is the primary medical reason for avoiding the basilic vein for routine venipuncture procedures whenever possible? Option A. The vein is too small to yield an adequate sample volume. Option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. Option C. The vein has a high tendency to collapse under normal vacuum tube pressure. Option D. The vein lacks a sufficient path to the superior vena cava system. The correct answer is option B. The vein is located in close anatomical proximity to the brachial artery and the median nerve. The basilic vein is avoided for routine draws because it lies close to the brachial artery and median nerve. Injury in that area can cause significant bleeding or nerve symptoms. Safer veins should be selected first whenever they are available. Question 46. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A. Wash the site with soap and water and immediately report the incident to a supervisor. Option B. Squeeze the wound to expel blood and apply a tight bandage. Option C. Wait until the end of the shift to fill out an incident report. Option D. Ask the patient if they have any blood-borne infectious diseases. The correct answer is option A. Wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 47. Which of the following tests is part of a routine liver function panel? Option A. Creatinine. Option B. Alanine aminotransferase, ALT. Option C. Hemoglobin A1c. Option D. Troponin I. The correct answer is option B. Alanine aminotransferase, ALT. ALT is a liver-associated enzyme included in routine liver function evaluation. It helps assess hepatocellular injury when interpreted with other liver markers. Creatinine, HbA1c, and troponin are associated with kidney function, glucose control, and cardiac injury rather than a standard liver panel. Question 48. Why is it essential to allow the 70% isopropyl alcohol to dry completely on the skin before puncturing? Option A. To prevent the alcohol from evaporating too fast. Option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Option C. To ensure the vein does not roll during insertion. Option D. To maximize the chemical interaction with the tube additive. The correct answer is option B. To avoid hemolysis of the specimen and a stinging sensation for the patient. Alcohol must dry completely so it can disinfect effectively and avoid being carried into the puncture site. Wet alcohol can sting and may contribute to hemolysis or specimen contamination. Blowing on or fanning the site can recontaminate the area and should be avoided. Question 49. What is the maximum amount of time a tourniquet should remain tied on a patient's arm during a venipuncture? Option A. 30 seconds. Option B. 1 minute. Option C. 2 minutes. Option D. 3 minutes. The correct answer is option B. 1 minute. Tourniquet time should generally be limited to 1 minute to prevent venous stasis and hemoconcentration. Longer application can concentrate proteins, cells, potassium, calcium, and other analytes. Releasing and reapplying after a pause is safer than leaving it tied while searching for a vein. Question 50. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B, ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 51. Which of the following tubes contains a clot activator paired with a thixotropic gel barrier designed for serum separation? Option A, light green top, PSD. Option B, gold or red /black marbled top, SST. Option C, lavender top, EDTA. Option D, light blue top, sodium citrate. The correct answer is option B, gold or red /black marbled top, SST. Gold or red-black marbled SST tubes contain a clot activator and thixotropic gel for serum separation. The clot activator speeds clot formation, and the gel forms a barrier after centrifugation. PSD tubes produce plasma because they contain heparin instead of a serum clotting system. Question 52. What type of urine specimen is ideal for routine screening and microscopic urinalysis? Option A 24-hour pooled collection. Option B, a random, first morning voided specimen. Option C, a multisample postprandial catch. Option D, a catheterized 12-hour collection sequence. The correct answer is option B, a random, first morning voided specimen. A first morning void is concentrated and useful for routine screening and microscopic urinalysis. It improves detection of cells, casts, proteins, and other substances that may be diluted later in the day. Timed collections and catheterized specimens are reserved for specific orders. Question 53. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 54. Which of the following veins runs along the lateral, outer, aspect of the antecubital fossa and is considered the second choice for venipuncture? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, axillary vein. The correct answer is option B, cephalic vein. The cephalic vein runs along the lateral, thumb side aspect of the antecubital area. It is often considered after the median cubital vein because it may be less anchored or harder to access. The basilic vein is medial and closer to major nerves and arteries. Question 55. What type of consent is demonstrated when an adult outpatient rolls up their sleeve and extends their arm toward the phlebotomist after being asked for a blood draw? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Rolling up a sleeve and extending the arm after being asked to provide a specimen demonstrates implied consent. The patient's actions show cooperation with a routine procedure. Signed informed consent is a more formal process used when required by policy or procedure risk. Question 56. Which of the following structures is an example of an unoxygenated blood carrier? Option A, pulmonary vein. Option B, aorta. Option C, superior vena cava. Option D, brachial artery. The correct answer is option C, superior vena cava. The superior vena cava carries deoxygenated blood from the upper body back to the right atrium. Most systemic veins carry unoxygenated blood, while most systemic arteries carry oxygenated blood away from the heart. The pulmonary vein is an exception because it carries oxygenated blood to the left atrium. Question 57. Which of the following is the correct order of draw for a dermal, capillary, puncture? Option A, lavender, green, red. Option B, red, green, lavender. Option C, green, lavender, red. Option D, light blue, lavender, green. The correct answer is option A, lavender, green, red. Capillary collections prioritize EDTA specimens first because small skin puncture samples clot rapidly. Other additive tubes follow, and serum tubes are typically collected last because clotting is expected there. Using venipuncture order for capillary specimens can allow microclots to compromise hematology testing. Question 58. Why is the first drop of blood wiped away during a capillary puncture? Option A. It contains skin surface bacteria. Option B. It contains tissue fluid contamination. Option C. It hemolyzes too rapidly to be accurate. Option D. It clots too quickly to be collected. The correct answer is option B. It contains tissue fluid contamination. The first drop from a skin puncture often contains tissue fluid and surface contaminants from the puncture process. Wiping it away improves specimen quality and reduces dilution of the sample. Collecting that first drop can contribute to inaccurate chemistry or hematology results. Question 59. What is the clinical term for a decrease in the total number of circulating red blood cells or a decrease in hemoglobin concentration? Option A. Polycythemia. Option B. Anemia. Option C. Leukemia. Option D. Leukopenia. The correct answer is option B. Anemia. Anemia means a decrease in circulating red blood cells, hemoglobin concentration, or oxygen carrying capacity. It can cause fatigue, pallor, shortness of breath, or dizziness depending on severity. Polycythemia is increased red cell mass, while leukopenia involves white cells. Question 60. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A. 70 to 99 mg/dl. Option B. 140 to 180 mg/dl. Option C. 200 to 250 mg/dl. Option D. 300 to 350 mg/dl. The correct answer is option A. 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 61. What does the term basal state refer to in clinical laboratory testing? Option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Option B. The physical state of the body directly following a heavy workout session. Option C. The point of highest metabolic activity in the afternoon. Option D. The body's state while under heavy psychological stress. The correct answer is option A. The condition of the body early in the morning, resting and fasting for roughly 12 hours. Basal state refers to the body's resting condition after fasting, usually early in the morning. This state reduces the effects of recent meals, exercise, stress, and daily variation on laboratory values. Heavy activity or psychological stress can significantly alter some analytes. Question 62. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A. Using a needle with a large lumen, such as an 18-gauge needle. Option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C. Inverting a serum separator tube gently 5 times after collection. Option D. Centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B. Drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 63. Which of the following can lead to a rejected specimen due to short draw? Option A. Inverting a lavender tube 8 times. Option B. Underfilling a light blue coagulation tube. Option C. Using a 21-gauge needle on a large vein. Option D. Drawing a serum separator tube before a green tube. The correct answer is option B. Underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, NHACPT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 64. When instructing a patient on how to collect a clean catch midstream urine sample, what is a key step? Option A. Voiding directly into the cup without any prior cleaning steps. Option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Option C. Saving all urine voided over a continuous 24-hour window in a refrigerated jug. Option D. Restricting fluid intake for 48 hours prior to voiding the sample. The correct answer is option B. Cleansing the genital area with an antiseptic wipe, voiding a small amount into the toilet, and then catching the middle portion of the stream in the cup. Clean catch midstream collection reduces contamination from skin and genital flora. The patient cleanses first, begins voiding into the toilet, and then collects the middle portion of the urine stream. Collecting the first urine directly into the cup increases contamination risk. Question 65. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option A. 1.0 mm. Option B. 2.0 mm. Option C. 3.0 mm. Option D. 4.0 mm. The correct answer is option B. 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 66. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 67. Which of the following elements must be matched precisely between a patient's requisition sheet and their wristband? Option A. Patient's first name, last name, and unique medical record number. Option B. Patient's room number and name of their primary insurance carrier. Option C. Name of the ordering physician and the date the patient was admitted. Option D. Patient's diagnosis code and home phone number. The correct answer is option A. Patient's first name, last name, and unique medical record number. The requisition and wristband must match the patient's name and unique medical record number or equivalent identifier. Matching these identifiers confirms that the order belongs to the patient being drawn. Insurance, diagnosis, and physician information do not establish patient identity at the bedside. Question 68. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A. Use the tube anyway if it is the only one available on the tray. Option B. Discard the expired tube and select a current, unexpired tube from inventory. Option C. Assume the additive inside is still functional for another 6 months. Option D. Write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 69. What is the correct protocol for mixing an additive tube after filling? Option A, shake it vigorously up and down 5 times. Option B, roll it back and forth between your palms for 30 seconds. Option C, invert it gently back and forth the recommended number of times. Option D, let it sit completely still in a rack to mix naturally. The correct answer is option C, invert it gently back and forth the recommended number of times. Additive tubes must be mixed by gentle inversion the number of times recommended for that tube. This ensures blood contacts the additive without causing mechanical cell damage. Shaking, rolling, or leaving the tube unmixed can lead to hemolysis or clot formation. Question 70. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry. Hematology, microbiology, and blood bank perform different categories of testing. Question 71. Which of the following factors can cause a false decrease in a patient's serum glucose measurement? Option A, separating the serum from the red blood cells within 30 minutes of collection. Option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Option C, transporting the specimen to the laboratory on an ice slurry. Option D, utilizing a gray top tube containing sodium fluoride to collect the sample. The correct answer is option B, leaving the uncentrifuged specimen tube at room temperature for over 2 hours, allowing cells to consume glucose via glycolysis. Glucose can fall falsely when an uncentrifuged specimen sits at room temperature because cells continue to metabolize glucose. This ongoing glycolysis lowers the measured concentration over time. Prompt separation or collection in a fluoride-containing tube helps prevent the decrease. Question 72. What does the term homeostasis mean? Option A, the stoppage of blood flow from an injured vessel. Option B, the steady state or dynamic balance of the body's internal environment. Option C, the destruction of old red blood cells in the spleen. Option D, the production of new cellular elements in the bone marrow. The correct answer is option B, the steady state or dynamic balance of the body's internal environment. Homeostasis is the body's dynamic process of maintaining internal stability. It includes regulation of temperature, fluids, pH, glucose, and other physiologic variables. Hemostasis is specifically the stopping of bleeding and is a different term. Question 73. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 74. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option D, lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 75. What color top tube contains the additive thrombin, which acts as a rapid clot activator for stat serum determinations? Option A, orange top. Option B, light blue top. Option C, lavender top. Option D, gray top. The correct answer is option A, orange top. Orange top tubes contain thrombin, a rapid clot activator used for some stat serum determinations. Thrombin speeds clot formation so serum can be processed quickly. Anticoagulant tubes such as lavender, gray, and light blue are intended to prevent clotting rather than accelerate it. Question 76. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 77. According to the Clinical and Laboratory Standards Institute, CLSI, which tube must be collected first in the standard order of draw? Option of light blue top. Option B, lavender top. Option C, blood culture vials. Option D, green top. The correct answer is option C, blood culture vials. Blood culture bottles are collected before other tubes to protect sterility and prevent additive contamination from later tubes. This order is especially important because even minor contamination can affect organism recovery and antibiotic decisions. Coagulation, hematology, and chemistry tubes follow later because their additives can interfere if carried into cultures. Question 78. Why is a royal blue top tube used for trace element and toxicology testing? Option A. The tube contains a unique fast-acting liquid anticoagulant. Option B. The tube stoppers are specially manufactured to be free of trace element contamination. Option C. The tube is thicker to resist breaking in specialized centrifuges. Option D. The tube completely blocks out all infrared and UV rays. The correct answer is option B. The tube stoppers are specially manufactured to be free of trace element contamination. Royal blue tubes are manufactured to minimize trace element contamination from stoppers, glass, plastic, and additives. This is essential for toxicology and trace metal testing where very small contamination can alter results. The color does not mainly indicate light protection or faster anticoagulation. Question 79. Which of the following additives is present in a light green top plasma separator tube, PSD? Option A, sodium heparin and a gel barrier. Option B, lithium heparin and a gel barrier. Option C, DDTA and a gel barrier. Option D, clot activator and a gel barrier. The correct answer is option B, lithium heparin and a gel barrier. Light green PSD tubes contain lithium heparin and a gel barrier. Lithium heparin prevents clotting, and the gel separates plasma from cells during centrifugation. SST tubes contain clot activator for serum rather than heparinized plasma. Question 80. What is the proper angle of insertion when using a winged infusion set, butterfly needle, to draw from a hand vein? Option A, 5 to 10 degrees. Option B, 10 to 15 degrees. Option C, 30 to 45 degrees. Option D, 60 to 90 degrees. The correct answer is option B, 10 to 15 degrees. A butterfly needle is inserted at a lower angle, often about 10 to 15 degrees, especially for superficial hand veins. The shallow angle helps enter small veins without puncturing through them. Steeper angles are more likely to cause infiltration or injury in hand veins. Question 81. What type of vessel links the smallest arterial pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 82. Which of the following additives works by chelating or binding calcium to inhibit the coagulation cascade? Option A, lithium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium fluoride. Option D, ammonium oxalate. The correct answer is option B, ethylenediamine tetracetic acid, EDTA. EDTA chelates calcium, removing a key requirement for activation of the coagulation cascade. This prevents clot formation and preserves whole blood for hematology and selected molecular tests. Heparin prevents clotting through antithrombin rather than calcium chelation. Question 83. Which of the following statements is true regarding a multisample needle gauge? Option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Option B. An 18-gauge needle is smaller than a 23-gauge needle. Option C. The larger the gauge number, the larger the needle lumen. Option D. All needles used in phlebotomy have the same internal diameter. The correct answer is option A. A 21-gauge needle has a larger opening than a 22-gauge needle. Needle gauge numbers work inversely: the higher the number, the smaller the lumen. A 21-gauge needle therefore has a larger opening than a 22-gauge needle. Assuming all phlebotomy needles are the same size can lead to poor device selection and hemolysis risk. Question 84. Which of the following parameters is most heavily impacted if a phlebotomist squeezes or milks a finger during a capillary puncture? Option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Option B. The blood flow will stop completely due to arterial vasoconstriction. Option C. The platelet count will become falsely elevated beyond high limits. Option D. The glucose values will drop to zero within seconds. The correct answer is option A. The sample will be contaminated with tissue fluids, leading to inaccurate results or hemolysis. Milking a finger forces tissue fluid into the drop and can rupture cells. This dilutes the specimen and may cause hemolysis or inaccurate results. Gentle warming and proper puncture technique are preferred ways to improve blood flow. Question 85. Which of the following legal terms is defined as the unauthorized, harmful, or offensive touching of another individual? Option A. Assault. Option B. Battery. Option C. Defamation. Option D. Malpractice. The correct answer is option B. Battery. Battery is unauthorized, harmful, or offensive physical contact with another person. In phlebotomy, drawing blood without valid permission can constitute battery. Assault involves threat or fear of contact rather than the contact itself. Question 86. What is the function of the systemic circulatory system? Option A. Moving blood exclusively between the heart and the lungs for gas exchange. Option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Option C. Filtering liquid waste products through the nephron beds of the kidneys. Option D. Producing white blood cells within the flat bones of the axial skeleton. The correct answer is option B. Routing oxygenated blood and nutrients from the heart out to the rest of the body tissue networks. Systemic circulation delivers oxygenated blood and nutrients from the left side of the heart to body tissues. It also returns deoxygenated blood and metabolic waste products back toward the right side of the heart. Pulmonary circulation is limited to blood flow between the heart and lungs. Question 87. What type of fluid is obtained during a lumbar puncture procedure? Option A. Pleural fluid. Option B. Synovial fluid. Option C. Cerebrospinal fluid, CSF. Option D. Peritoneal fluid. The correct answer is option C. Cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 88. What should a phlebotomist do if they observe small, red spots appearing on a patient's skin after applying a tourniquet? Option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Option B. Tighten the tourniquet further to stop the spots from spreading. Option C. Ignore the spots, as they are a normal reaction to isopropyl alcohol. Option D. Rub the skin surface firmly to see if the spots disappear. The correct answer is option A. Remove the tourniquet immediately, as this indicates petechiae and potential bleeding issues. Petechiae after tourniquet application suggest fragile capillaries or a bleeding tendency. The tourniquet should be removed and the site reassessed before proceeding. Continuing pressure can worsen capillary bleeding and bruising. Question 89. What clinical condition is characterized by a high accumulation of bilirubin in the blood, causing a yellowing of the skin and sclera? Option A. Cyanosis. Option B. Jaundice, icterus. Option C. Erythema. Option D. Pallor. The correct answer is option B. Jaundice, icterus. Jaundice, also called icterus, results from elevated bilirubin levels in blood and tissues. It causes yellow discoloration of the skin and sclera. Cyanosis, erythema, and pallor describe blue, red, and pale color changes from different causes. Question 90. If a phlebotomist needs to collect blood from an infant via venipuncture, what is the preferred needle choice? Option A. A 21-gauge standard multisample needle. Option B. An 18-gauge hypodermic needle. Option C. A 23-gauge or 25-gauge winged infusion set, butterfly. Option D. A large bore trocar needle. The correct answer is option C. A 23-gauge or 25-gauge winged infusion set, butterfly. Infant venipuncture requires a small, controlled device to reduce vessel trauma. A 23 or 25 gauge winged infusion set allows better stability and visualization in small veins. Large bore needles increase injury risk and are not appropriate for fragile pediatric veins. Question 91. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A. Assault. Option B. Battery. Option C. Invasion of privacy or breach of confidentiality. Option D. Negligence. The correct answer is option C. Invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 92. Which of the following tests requires a strict chain of custody tracking form to accompany the specimen through collection, processing, and analysis? Option A. Basic metabolic panel, BMP. Option B. Forensic drug analysis or paternity testing. Option C. Therapeutic drug monitoring for digoxin. Option D. Blood culture tracking for endocarditis. The correct answer is option B. Forensic drug analysis or paternity testing. Forensic drug analysis and paternity testing require strict chain of custody tracking from collection through analysis. This documentation preserves legal defensibility and proves specimen integrity. Routine clinical tests generally use standard identification and accessioning procedures. Question 93. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A. Extensive hemolysis from using a small gauge needle. Option B. Lipemia caused by high concentrations of lipids or fats in the blood sample. Option C. Icterus caused by elevated levels of circulating bilirubin molecules. Option D. Failure to invert an additive tube immediately after collection. The correct answer is option B. Lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 94. Which additive is present in a light blue top tube used for coagulation testing? Option A, sodium heparin. Option B, ethylenediamine tetracetic acid, EDTA. Option C, sodium citrate. Option D, potassium oxalate. The correct answer is option C, sodium citrate. Sodium citrate prevents clotting by binding calcium while preserving coagulation factors for testing. The tube must be filled properly because the citrate-to-blood ratio directly affects clotting test accuracy. EDTA, heparin, and oxalate tubes use different anticoagulant mechanisms and are not substitutes for routine coagulation studies. Question 95. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A, blood culture, gold SST, lavender. Option B, gold SST, lavender, blood culture. Option C, lavender, blood culture, gold SST. Option D, blood culture, lavender, gold SST. The correct answer is option A, blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 96. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A, the needle will cause the hematoma to spread to the opposite arm. Option B, the sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C, the vacuum tubes will implode due to tissue density variations. Option D, it will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 97. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F, 1.0 mm. Option B, 2.0 mm. Option C, 3.0 mm. Option D, 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 98. Which additive acts as a glycolytic inhibitor in a grey top tube? Option A, sodium fluoride. Option B, lithium heparin. Option C, DDTA. Option D, thrombin. The correct answer is option A, sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in grey tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 99. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A, cryoglobulins. Option B, ammonia. Option C, lactic acid. Option D, free fatty acids. The correct answer is option A, cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 100. What type of vessel links the arterial system directly to the capillary network paths? Option A, arteriole. Option B, venule. Option C, vena cava. Option D, deep vein. The correct answer is option A, arteriole. Arterioles connect arteries to capillary beds and regulate blood flow into tissues. Their muscular walls can constrict or dilate to control local perfusion. Venules drain capillaries, and lymph ducts carry lymph rather than arterial blood.